Hello and welcome to New Beginnings podcast with Michelle. We here at Functional Wellbeing are happy to have you on board, listening in, sharing your views, sharing all that you have learned and wanting to learn. And we are here for you, the whole you becoming the well you. Functional Wellbeing New Beginnings podcast. We've had so many guests so far. This is our 37th podcast, and we have had the opportunity to talk to people in the different spheres of their life, sharing their talents, whether it's in finances, whether it's teaching about marriage counseling, talking about relationship counseling. We also look at health, for sure. We always look at health, community building, learning about if you're introvert, what you can do and share, how you can shine your light and share your talents with others. We are so happy that many of you are gleaning from these podcasts, and we enjoy doing this for you. So today, we are going to continue sharing all about how you can enhance your well-being. One way is through health, and that's where functional well-being comes into play. Michelle here at Functional Wellbeing. I am sharing with you today some aspect of how you can use your health to enhance your well-being. This month is the month of May ending up, and I wanted to share a little bit more about mental health, but with the brain-gut axis and looking at functional nutrition. So we've had a lot of different people chiming in, sharing ways we can help our mental health. One of them is being able to cope with situations, talk to someone, get to a counselor, let them hear you out so they can hear you. Talk to a friend, talk to a pastor. We have been sharing and hearing about by many different people online things and ways you can do to help your mental health. I want to share with you today how you can help your mental health through functional nutrition. Yes? All right. I have an affirmation for you today. It is, I am open-minded to deeper healing. I am open-minded to deeper learning. I am open-minded to being transformed. Behold, I am open-minded to begin being made new. This is an affirmation made by Iana Vincent, and I love it because it helps me understand that I am able to be open-minded, to learn, to heal, to be transformed, and to be made new. And I hope this would be the same for you, because we being open-minded can help us to learn how we can help our mental health in different ways. And today, I would like to share with you how you can change your mental health through nutrition. Functional nutrition. Functional being, it can work for you. How we can use nutrition to help anyone and any situation that's going on with us with a nutrition that could help you. Great. So, for those who don't know who Michelle Bailey is, I want to share a little bit about me. I am a mom, a wife, an aunt, a sister. I am Michelle Bailey. I'm from Trinidad and Tobago, and that's where I was born, but I reside currently in the US, in the Midwest, Indiana. And for the time of my life, I have been always interested in being healthy. I started off at age 11, wanting to change what I look like and feel better. And since then, I've been exercising. At 16, I started doing weight training, loved it, still love it, still doing it to this day. And I always wanted the opportunity to change what I look like, how I feel, and have that control over having a healthy lifestyle continuously. And to this day, I am loving physical activity in my life as well as learning what I should be eating. Throughout my journey, I've been an athlete as well in bodybuilding, a figure athlete, and I've been a wellness athlete. And in the scope of being an athlete, I had to learn how to eat. So, dieting, as people would say, was the way of life. But guess what? Dieting is the way of life because dieting just means eating a certain type of food groups of food throughout the day. We do it all the time. So dieting is not a bad word, okay, guys? Don't look at dieting as a bad word. And as I continue my life, I wanted to learn even more or have a deeper understanding of functional nutrition. Hence, I got into it. And in the past 2 years, it has helped me tremendously with medical issues that I may have had and still have, as well as helping others. My biggest goal is always to help others. So here I am today with functional well being, wanting to enhance your well being through health. By the information I have gleaned over the years as an athlete, as a personal trainer, as a chiropractic assistant, as an EMT, and now as a functional nutrition practitioner, I want to help you feel better, look better, and enjoy a healthy lifestyle for a long time. Yes. So I am here today to share a little bit about nutrition and the brain gut axis. The brain gut axis is basically looking at how we can use food to help, in this case, our mental well being. So, to get into this, I looked at two different articles. One is one from 2019 and the other from 2015. And they looked at the mental health and the brain gut axis in two different ways. Doctors realized that they needed to be able to understand that clinical intervention for patients suffering with depression and anxiety needed a nutritional psychiatrist to help them figure out the real way to help people having depression or anxiety. Clinical practice has shown that psychiatric patients experience increased morbidity and mortality associated with a range of medical illnesses. The article also says, in addition, lifestyle, psychiatric medications, and inadequate health care all contribute to the poor physical health of people with mental illness. So this article has shared with us, and the article name is Nutritional Psychiatry, the Gut-Brain Connection. It is looking at when we consider the things that we eat, it plays a part in if we are overweight, if we have higher levels of depression or anxiety, It also plays a role in the amount of medication that this person or individual may have to take to combat depression and anxiety. But it is saying also that nutritional interventions may be helpful to patients who want to combat the adverse effects of the medications that they are taking. So most medications have a side effect, or two, or three, or four. So they're saying here, through nutritional psychiatry, they have found that there needs to be a balance with respect to the nutritional interventions one may use to help patients who want to combat the adverse effects of the medications that they're taking. So they also stated in this doctor, his name is Nadio. I'm going to spell that name for you. Umadevi. I don't want to butcher it. But this doctor also said that recommendations such as eating a healthy diet of fresh fruits, vegetables, whole grains, and lean protein seem simple. Doctors do not routinely discuss diet with their patients. So this is general practitioners they're suggesting. He's suggesting the gap in nutrition education in our medical schools has left many practicing clinicians without a language to discuss dietary interventions with patients. So to fill this void, nutritional psychiatry provides useful action-oriented steps to patients, and it is a potentially powerful tool for clinicians. The second article we looked at, it was a compilation of doctors in 2015 that were looking at the way in which psychiatry can become an important juncture to help with current pharmacology focus model, having achieved modest benefits in addressing the burden of poor mental health worldwide. All right. And in this article, it said evidence is steadily growing for the relation between dietary quality and potential nutritional deficiencies and mental health, and for the select use of nutrition-based supplements to address deficiencies has been an idea that they purported that can help with mental health issues. All right. So I looked at these two articles because it's basically telling us we need to look at the foods that we consume that can help us change whatever mental health issue we may have. For instance, depression or anxiety or even Alzheimer's. We can look at food to help us change any medical issue going on in our full body system, actually. But now we are looking at mental health. Have you ever heard of the brain-gut axis? So the brain-gut axis is the connection between your brain and your gut in your digestive system, the stomach. And the brain-gut is connected via the vagus nerve. Not Vegas in Las Vegas, but the vagus nerve. Where can you find this nerve? The vagus nerve is to the back of the base of your head or your brain, just under in that sink. So you can take your two fingers, put it underneath your head, your brain area there, and you feel like a sick area, that is the vagus nerve. Now, the vagus nerve is a very beautiful nerve that we want working all the time because this allows for the transmission of the nervous system. It helps with the nervous system to work well. All right. The vagus nerve allows for a bi-directional communication between the brain and the gut. Your stomach, your small intestines, your large intestines, your liver, your whole digestive system. It helps with that connection. This wandering nerve, that's what the vagus nerve is called, helps us to be able to figure out a lot of different things, help our systems to work better. So the gut and brain are in constant bi-directional communication through the vagus nerve. The bacteria in the gut digest the food you eat and create a neurotransmitters. The lining of our gut contains an independent nervous system. And this nervous system also helps with the breaking down of the food, how we use this food. So the nervous system it works through and through. All right. And studies in mice show that changes in the microbiome, the gut bacteria, changes their behavior with regards to what they eat. So when we eat food, we digest it. When we digest this food, it either goes through our bloodstream or the rest goes down to our colon. And this is if things are working just smoothly. Once we get the nutrients from the food going through our bloodstreams, it helps with strengthening our muscles, it helps with the brain to work better. So there's that bi-directional working going on every time. If there's a kink in the system, you would know. So for instance, if we are not feeling well or we are depressed about something, most of the times we might think, okay, I'm depressed. I want to eat something. I want to eat something that will comfort me. And we go for a bowl of ice cream. That's our brain signaling, okay, I want something to comfort my situation. Give me something to eat. I want to feel good. I want to eat the comfort foods. I want to eat a whole pie. So we have our full body systems being affected. So the brain, right? Foods that we want to eat and our endocrine system. So say, for example, if it is we will be chased by a dog and we're afraid of dogs, so we run it. Our body would be like, okay, we in fight or flight mode. We gotta get out of here. If it is you was eating at that time, your body is studying about eating. It's trying to save your life. So all you're thinking about right now is running as fast as you can. So your adrenals are pumped up, right? So something on the outside affects you, your body responds. Something in the inside. So if you depressed about something, something in the inside could affect you as well. So for instance, if it is we eat certain foods, it can create problems in the lining of our gut. It can also cause problems in the lining of our brain. Once it passes through the bloodstream, there can be a positive or negative effect of the foods that we eat. So that's where the brain gut connection comes into play, right? We need to understand what we consume affects us. It can affect us mentally. Okay. So some chemicals in foods can affect us with creating constant anxiety. And then you'll say, but that can be. Yes, it can, because of that connection between the brain and the gut. Foods can be effective to how these body parts work, whether they work in a good way or a bad way. And this is something that I've learned through doing my program in functional nutrition, that when things show up in our bodies, so for instance, you're all of a sudden diabetic, or you have high blood pressure, or you have hypothyroidism or hypothyroidism problems, we have to understand that there are ways in which we can help ourselves by figuring out what is the root cause of these problems. So for somebody who has never had diabetes and then all of a sudden in their 40s or their 50s they fall diabetic, we need to understand that something has been going on for quite some time within your system, but is now showing up. Somebody who's having a lot of bloating, migraines, joint pain, all of a sudden in their 40s, 50s, and you never had these issues before, it's not just old age. It's because of the things that we were eating before is affecting us now. Our system, full body systems, cannot do the job that it was doing before effectively, because over the years we've been damaging these body systems. When we consider these symptoms or issues, we like to call it the branches. In my program that was developed by Dr. Andrea Nakayama of functional nutrition, she would say it's the roots versus the branches. We need to know that the branches are the symptoms, the arthritis, the migraines, the allergies, the rashes that we might see on our skins. This is symptoms, and there has to be a root cause creating this problem to occur. We need to find out what the root cause may be, whether it's an inflammatory issue, so inflammation being the root cause, and inflammation of any of the body systems. For instance, you having inflammation happening in your joints because something else is happening inside of you within internal organs. Or genetically, we are all gifted with the genetics of our parents. And if they have certain medical issues, we would be susceptible to them. Our genetical makeup is susceptible to getting these branches. We could prevent them, okay? But we have to know what to do to prevent them. And nutrition plays a huge role in doing that. Another route can be your digestive system. Is your digestive system functioning correctly? Or do you have a leaky gut? And as you see, the brain gut connection, if we have any health deficiencies with our digestive system, that can have extensive, very extensive negative play on the rest of our body, our brain. So if we are highly stressed, stress is an outside, it can be an internal as well as an external factor that could create a problem for us when it comes to our digestive system. It can, if we stress our bodies with external factors, so for instance, we're working too much, we're not sleeping, that can become a stressor to our system and create a problem for us in our digestive system, for instance, as well as our brain, which can create inflammation. And then we may have migraines, which would then be we all out. We can't do anything. So we go pop a pill. We could not pop a pill, but rather look at the foods that we eat, reduce our stress so that we can have a better, healthier mental health. Yes, so we can reduce depression or anxiety. So this is why I said this affirmation before. I am open-minded to deeper healing. I am open-minded to deeper learning. I am open-minded to be transformed. Behold, I am open-minded to being made new. We have to learn that there are things that we can do to help us have better mental health. There are many coping strategies out there, and today I'm sharing with you how we can use nutrition as a way to help us have a better mental health. Other than nutrition, I want to share some other coping strategies we can use. For instance, meditation, deep breathing is a great way to desensitize and help our bodies relax, change adrenal levels, change the endorphins. It can help us relax and reset ourselves. So some breathing techniques, we can find many of them online. One of them I like is the breathing 4 to 6 seconds in, hold it there, and breathe out 4 to 6 seconds out. Simple as that. This breathing technique, you can increase it. If you're a beginner in breathing techniques, come on now. Don't try to hold your breath too long. You're going to have a problem. We don't want that to happen. All right. And this, when we do things like breathing techniques, or for example, chanting or gargling, that actually helps the health of your vagus nerve and their vagus nerve stimuli. So you want to use these exercises like breathing techniques, chanting, or gargling. That can help you help stimulate your vagus nerve, which will then help that connection between the brain and the gut to be a healthier one. Another thing that can help us is like just cooking. My mother-in-law says cooking is her therapy. And yes, cooking can become a therapy for you. Cooking your meals and taking time to bless your food is a good example or way in which you can use to help stimuli. It's another stimuli for the vagus nerve. And you can use this to help you reduce the amount of anxiety or even depression for you mentally. Okay. Always, always, I will ask you to be active. You being active, for example, exercising can be a way for you to reduce stress. And then in turn, you may not be anxious all the time as well as depressed. So you can use physical activity as well as another way to cope with stress and to help your mental health. Go outside for a walk, you know, take your pet with you or take your child with you. Go outside and have some fun. Physical activity is always something that can help with mental health. This can help you heal yourself and help you do better. Saying affirmations is another one. So there you go. You have about 4 different things you can do. I love saying my affirmations, but you know what? There's what you can also say an affirmation like, I am grateful to have this wonderful food that I just cooked. It's healthy. I know I just cooked the most healthy food for me. I love it. This is something, saying affirmations and being positive helps your mental health. It helps you not be depressed. It helps you to be able to feel better. All right. Nutritionally, however, I want to share some more information with you. So you cook the food, but what you cooking? You want to cook things that will help you if you have any issue going on. So remember the branches. So say you have a UTI, or you have depression, or you have foods, you may have inflammation. There are foods out there that can help you with mental health. So foods I would love for you to consider are macro and micronutrients. We need foods to help us. We need foods to help heal our bodies. Traditional whole foods are best. So you're looking at fruits and vegetables, you're looking at seafood, whole grains, lean meats, nuts. So I'm calling out foods here, but not all healthy foods are healthy foods for everyone. What is healthy foods for me may not be healthy foods for you. And if you're looking at helping mental health, we want to look at mainly anti-inflammatory foods. Foods that can reduce inflammation and help reset your body. So think the gingers. Take salmon, for instance. Think things that you want to eat to help you stay healthy. We look at high fiber foods. You want to look at omega 3s, fatty foods. So that is that macronutrients you want to get. You can get omega 3s from salmon, but you can also get it from plant-based foods as well. I like to suggest plant-based as in like Brazilian nuts, for instance. That's a really good omega 3 that you want to in digest. Another one is walnuts, really good digest food to digest with great omega 3s that can help you. Okay. You want to find foods with high phytochemicals. So I like to call them the gold, the greens, and the reds. You want to find any foods that you think of those colors. So think reds, cherries, think red onions, green. You want to take kale, oregano, spinach, golds, think the ginger, the turmeric. These are highly anti-inflammatory foods, and they have polyphenols in it. And this is basically antioxidants can help you with reducing inflammation, feeding the brain oxygen, and helping you heal. You want to get foods like that in your system. But again, not all foods are healthy foods for you or me. So we have to find out and figure out what are these foods that we can all consume to help us live a healthier life. You need to figure out what might trigger more migraine. So for some people, eating meats is something that they don't do and they're vegan. So you want to know that there are certain foods that you can get higher concentrations of fats, plant-based fats that you want to eat. You want to get foods with proteins. If you're not eating meat, you want to know what foods to eat for meat substitute for meat to help you get more proteins, to help build your muscles and help repair tissues, damaged tissues in your body. You want to eat certain carbohydrates to help you with digestion. So high fiber foods. You want to eat like the broccolis, but not everybody could eat broccoli. Again, we need to figure out what food is right for you. That's where I come in. That's what I learned about functional nutrition. The food has to be functionally working for you. So you want to look for foods to help your immune system. Cherries, they boost your immune system. Again, we want to like look at foods like beet to help reduce acidity in your GI tract. All right. Watermelon, with the summertime, that is a great hydrated food, but it also has great opportunity to help with inflammation in your body. But not everybody can eat watermelon, all right? Avocados, a favorite of mine for good fats. Then you want to have something to help balance off your bacteria, like your probiotics and your prebiotics. Sometimes we need more, some people need more of either or in your system to help balance out your system. So gut health, if you don't realize, gut health is something that you want to make sure you have going for you always to help you. Some people who have kidney function problems and things like bell peppers might help them or cranberries. But again, you need to know, okay, can I actually eat nightshades foods? Is that still creating a gut problem for me? Am I still feeling bloated eating things like that? What are some things that you can eat? I can help you figure that out. As one of the things that I look at is looking at the foods that you used to eat before and comparing what can you use now to help your body and help you cleanse your system so you can heal and reset, for example, your liver to help that detox, because the liver is the biggest organ in your body that helps detoxify your system. The liver is where your proteins, fats, and carbs are broken down further. So you want to have your liver, for instance, cleanse and be able to work in the best way possible to help you digest your food. So health of your digestive system is highly important for you having a good mental health. Because if you don't have a heal or good gut or digestive system working, there might be an issue now with how much nutrients you get out of the food that you eat. Yes. So you want to learn what are the right foods for you. To summarize, we need to continuously look to our maker to help us heal ourselves and our mental health. And how we could do that? Meditation, breathing techniques, helping yourself detoxify stress through just sitting there and, listening to what God has to tell you. Healing your gut, as I said before, is big. And the only way we could heal our gut is if we're eating the right foods for ourselves to do so. Things such as depression and anxiety, as research, can be influenced by what we eat. So the combination of mental health, talking to somebody. Remember, counselors, we need to talk. That's a way to cope. Go talk to somebody. You want to talk to God. You want to talk to people who have that talent or that gift to help you. So we have life coaches out there. We have counselors out there. We want you to go get help. Along with eating the right foods for you is important to conquer your mental health. Thank you so much for listening. I know that's a lot of information. So if you want help with this information, check me out. I can help you. Just email me, text me, message me, DM me. I can help you with this. You can find me at Functional Wellbeing LLC on Instagram. I also have my web app. I also have Twitter. You find me on Facebook as Michelle Blessed on Facebook. I am here to help you. Functional Wellbeing is all about helping you. And today on FXWB New Beginnings podcast, I want you to enhance your well-being through health, through functional nutrition. Thank you so much, guys, for listening in. I'm so happy to be here, and I want you to stay healthy, stay beautiful as you are, and we will see each other soon again on FXWB New Beginnings podcast. Have a great day and see you soon.
Ladies, ready to reclaim your fountain of youth? Come on board with me as I share with you 360-degree well-being coaching available today. Subscribe and I'll see you there.